So this scenario today is for IV cannulation, and for the scenario we'll be using it for the purpose of pain relief. So first of all, it's important that we gain informed consent from the patient. So firstly explaining what the procedure involves, the fact that there will be a cannula inserted via a needle into the vein, and then that will give us access to allow some good pain relief. So once we've gained informed consent, first of all it's about finding the vein, so attaching a tourniquet proximal to the area you're looking, using 2 fingers as we tighten to make sure that it doesn't pinch the skin, and then we are looking for a nice solid vein. So we can ask the patient to squeeze their fist to help distend that. I can see a nice clear cephalic vein through here, so I've selected that one. I'll undo the tourniquet as I prepare my kit. So I've pre-prepared this. We could have asked our offsider to do so. Once I'm happy that I've gone through that there's everything here that I need, we'll move back to the arm. So applying the tourniquet again, 2 fingers underneath when tightening. First of all, ensuring we're wearing the right protective gear, gloves and glasses, and then cleaning the puncture site. So with an alcohol swab, just one single movement over the puncture site and allowing that to dry. Now obviously with the insertion of a needle we would be expecting a sharp scratch, so it's important that I tell the patient this. So I would anchor the vein above and below to stop it from rolling, ensuring that I'm not touching the puncture site as it's now sterile. I'm ensuring that the bevel is up, and explain to the patient as I insert it, they will feel a sharp scratch. So that's going with a 30-degree angle. I've got positive flashback there suggesting we're on the vein, so I would flatten my angle out and advance the cannula. As I remove the needle, I'm going to occlude proximal to the puncture site with this finger here. Sharps out, straight into the sharps container, and releasing the tourniquet. While I'm still occluding that vein, we're going to attach a lure. Like so, and now document the time that was done. Okay. Now it's important that we secure the cannula that we've put in. So first of all, down the lure plug, making sure we're not going over the puncture site, and then applying the TED. Okay, and there is a little time, a place for us to put the time on here, so we can also put that on, just so that everyone knows when that was placed. Okay, so now that we've got that line in there, it's important that we flush it, but also just to check that it is still in there. So we've got our pre-made flush, just double checking that it is sodium chloride and that it is not expired. Okay, so attaching that into the lure. First of all, we're going to gently pull back just to see that there's some blood coming into the syringe, which there is, and then slowly advancing the flush. Now what I'm checking for here as I slowly push that in is to see if there's any blebs that appear under the skin, swelling, signs of infiltration, which is not, and it's moving quite freely into that vein, so I'm confident that I am actually in the vein. And again, documenting that time of the flush. Okay. So as mentioned at the start of the scenario, the purpose for this was pain relief. So today, what we're going to be doing is administering fentanyl IV. So attaching the drawing up needle, just ensuring that fentanyl is at the bottom of the vial, and completing a drug check. So firstly, checking that it is fentanyl, 100 micrograms and 2 mils, and expiry date 2020, I would get that double checked with my offsider to ensure that we're giving the right drug. Sharps out, straight into the sharps container, and we'll draw up the 2 mils. Sharps in. Okay, so we will add the 2 mils to make 10 with sodium chloride, which will give us 10 micrograms per mil. So sharps into the bin, and I have a pre-made label here. It says fentanyl, the dosage, and 10 micrograms per mil. So ensuring that we place that on there, not covering up the numbers. Okay, so now we have 10 micrograms of fentanyl per mil in a 10 mil syringe. So we would attach that to the lure. And we're going to start with 20 micrograms, so 2 mils of fentanyl. So just slowly milliliters. Again, this is labelled so we can place that back down, and documenting the time. Okay. Now it's important that we follow that with a flush. So again, I have another pre-prepared flush here, double checking that it is sodium chloride and that it's not expired again. Attaching it to the lure, and we're going to flush that with 10 mils. Just administering that slowly. So that's the IV Osces. So this next Osces is for EJV cannulation. So this skill can be used when the peripheral veins are no longer accessible, or during an emergency situation where rapid IV access is needed, such as cardiac arrest. So first of all, to distend the vein, there's a few techniques. First of all, we can raise the legs using the Trendelenburg position to distend that, applying direct pressure to the liver to stimulate the hepatojugular reflex. We can tamponade the jugular vein just above the clavicle, and also rotating that head right round to help visualise and distend that vein. So obviously if this patient was conscious, we would need to gain informed consent. So first of all, using an alcohol swipe just to clean the area, one movement over the puncture site and allowing that to dry. So usually this would be a large bore IV access, but for the sake of the mannequin today we'll use a 20 gauge. Now to reduce the risk of air entry and embolus, attaching a syringe of sodium chloride to the end. So this has previously been drug checked, but again, making sure that it is the right drug, it's not expired, and doing that with your crew partner. Okay. So removing the cap, sharps out, just priming that to make sure that there's no air in the needle. Okay. So I'll be tamponading the vein and just applying a little bit of stretch pressure there, and we're entering at a 30-degree angle in the upper third of the vein, ensuring that the bevel is up. Once we feel that we're in, we're going to aspirate, looking for fluid, for blood to come back up into the... Okay. So we'll be looking for the flashback there into the chamber to show that we are in fact actually in the vein. Once we're confident we are, we can lower and advance the cannula. I'll then tamponade to ensure that there's no blood. Sharps out, we go directly into the sharps container. I'll then use my plug my lure. Now it's important that we flush the cannula to ensure that we don't have infiltration and that we're in the vein. So we're looking for any signs of infiltration, bleeding, so forth around the vein. That's entering really nicely into the vein, no resistance, so I'm confident that I am in there. So now important that we secure the site using a Tegaderm. First of all, one strip across the lure there, ensuring that we're not going over the puncture site, as that's trying to keep that as sterile as possible. And securing that fastly with the Tegaderm. Now it's important that we document the time that we've done this, and there's a nice little place for that here. So recording the time that is in. Okay, so now that we've secured that, it's about attaching a line. So hooking up the running line, obviously doing the drug check, so making sure that it is the drug that you're after, in this case sodium chloride, that it is not expired, and doing that with the drug, with your partner as well, doing the drug check. So it's important that we prime the line to ensure that there's no air. Which we've got. Okay. So this would ideally be hung up, allowing the gravity assist to run the flow. So we would attach that to the lure. Making sure that's on properly. And we're wanting to secure that around the ear to ensure that if there was some movement, it's not going to compromise the line that we've just put in. So that can be done with some tape. And then obviously setting that at the flow rate of which is appropriate. So the next OSCE that we'll do is an intradermal administration of lignocaine. So lignocaine is a local anaesthetic that can be used prior to gaining large bore IV access. So obviously we need to be wearing the correct gear, gloves and glasses, but also in gaining informed consent from the patient, but double checking that they've got no allergies to anaesthetics. When administering the lignocaine, it is important that we do that close to the site that we're going to do our IV, so close to that vein, and obviously firstly ensuring that we have all the right gear. So first of all, we're going to clean the punch site with an alcohol swipe, just one swipe over the top of the skin. While we allow that to dry, we'll complete a drug check, so ensuring that it is obviously lignocaine, that it's not expired, and the correct dose. So we've got 50 milligrams and 5 mils of lignocaine. I'd get that double checked with my crew partner. So it's important that we administer this aseptically. So for this technique, because we're only using a small dose, we'll use a 3 ml syringe. So attaching the drawing up needle. So the adult dose is between 0.5 and 1.5 mil. So today we're going for 1 mil, which will give us 10 milligrams. So we'll draw up 1 mil. Okay, and it's important that we select the right size needle, so we've gone for a 25 gauge. sharps out. Okay, so this would have given the alcohol enough time to dry, so it's important that when administering the lignocaine, we do so, like I've said, close to the vein, but at a less than a 15-degree angle. We're aiming just to get under the skin. So we just go in, sharp scratch. Once we're just underneath the skin there, we're going to slowly administer the lignocaine. So what we're firstly going to do here before we administer it is aspirate to double check that we're not in a blood vessel. I've got resistance there, no backflow of blood, so that's a positive sign. So we're going to slowly administer that in. So what we're looking for here is the formation of a bleb underneath the skin, which we can see is starting to form around the puncture site there. So once that lignocaine's in, sharps out, and we're straight into the sharps container. So it's really important after the administration of this lignocaine that one, we give it time to work, but that we look and assess for any changes in terms of allergic reactions over the next minute. Documentation, as always, is key, so ensuring that we've double checked the time that that's been administered, writing that down and documenting that appropriately.